Okay, good morning, everyone. So, good morning, Dr. Jenifer.
Good morning, ma'am. Good morning, everyone.
So, today it's an important topic, how to write manuscript. I think I have seen so many residents, they struggle a lot when I say that write manuscript from your thesis or write manuscript or from this data. So, I think this is the best opportunity to learn how to write manuscript. And this topic will be taken by Dr. Jenifer Jeba. I think most of us we know Dr. Jenifer very well, that she is the right person to tell you how to write manuscript and how to. There is no need to struggle. So I'm very happy that she is here today. And uh, Dr. Jenifer, for those who are new joining, she's professor and head of the department at CMC College, Vellore. She is also honorary senior lecturer from School of Medicine, Cardiff University. She has received Dame Cicely Sonder Medical Award from Cardiff University. She is also an associate editor of British Medical Journal, Supportive and Palliative Care, very important journal, and she is already taking care of this journal very well. And she has got, you must see her publication, and you should Google today. She has got wonderful publication in various areas, and her key areas of interest are respiratory palliative care, strengthening primary palliative care, and communication and ethics in palliative care. On personal note, I know Dr. Jenifer since last many years, and whenever there is anything related to Indian Association of Palliative Care, or whenever there is something we are working on, policy document or protocol formation, and in these days we are working with the Academy of Palliative Medicine, I think she is in the front, who is helping us, supporting us in IAPC in a big way. So Dr. Jenifer, thank you very much for joining, and please take your lectures. Thank you very much.
Thank you, ma'am. I'm not sure if I deserve all that you said, but thank you for your generous words, and I will share screen. Is it visible? Full
Yes,
screen?
Yes. Thank you.
Thank you, and good morning, everyone, for joining very early in the morning. And this is kind of the perseverance and determination that is actually needed in also doing something like this, not just listening to a session on manuscript writing. So I want to thank Dr. Sushma and IAPC for this opportunity. And I want to declare that I am also in the learning process. And there are many senior people who probably achieved more, and I respect their contribution to palliative medicine and global science. So we've been doing a series on research, and this step on manuscript writing is actually the culmination of the study and research that one has done. So you can do a great study, you can follow all the steps, you can do it all well, but if it really doesn't move from research to writing and dissemination, we kind of hinder the growth of science and also one's own career. So writing up what you've done is very important. So what I'll do in the next 45 minutes or so is to take us through writing as a skill, how to get started, what are the different sections in a manuscript and what to consider in these sections, and common reasons for rejection. So we've gone through much of these, the key principles in research, asking the right questions. So manuscript writing alone is not going to get your research published, but a good research starts with asking the right question. Is it an important question? Can it be answered? And how relevant is this question in our context? Choosing the right method and design to do it. How can I find an answer to this question that I have? Do I have the right resources? Can I do the right analysis? And once the analysis is done, how to rightly interpret it? And today we will be looking on good writing, and which will again disseminate it and promote further research. So you will all be familiar that in any journal, you would see different types of articles from case report to original research, review, editorials, letter to the editor, commentary or opinions. And as a junior, we might start with writing a case report. And many of you as MD or DNB students will be doing a dissertation which would involve an original research. So today I would focus on the layout of original research and how to write a good manuscript. In palliative care, we are also familiar about how important communication skill is with our patients and how effective that should be. And this writing is a different form of communication skill. And it needs to be effective if we need to convey the concept that we want to say. What concept, what contribution, how do we convey that? But however, looking at the entire scientific writing, one may think, oh my, I cannot go through this process. It appears so tedious and time consuming. But I should say it is both a joy and a trial. It is time consuming, daunting, but at the end of it, it is very, very rewarding. So some of us may think, oh, I have not had a training, no experience, I have not written any paper yet. I'm not familiar with the writing requirements. And that may prevent us from even starting, or we start, write a paragraph, write a section, and then we do not proceed. We are afraid that all the time that we dedicate, will it end up in something? Some of us are genuinely we suffer lack of time because of other commitments at clinical work, family, and other things. And one barrier can be that, you keep sitting on a manuscript again and again and again. You think you can improvise it and waiting for perfection, and it never leaves your desk. However, the good news is that this is a skill. Writing as a skill can be developed and learned. So this is how David Cook puts it. A manuscript in preparation, a manuscript in preparation will remain in preparation indefinitely unless acted upon by a motivated author. It will not get published as long as it sits on your desk. You need to get the manuscript off of your to-do list and onto someone else's, that is the editors and then the reviewers. So I would encourage that you start writing regularly. Write 15 minutes per day. It is said that writing small amounts on a regular basis is more productive than you postpone the entire thing and wait for a large chunk of time, which may or may not come. Set realistic deadlines. Be ready for multiple refined drafts. None of us, or very rarely, some very great writers may get their draft pakka at the first writing, but many of us will need to keep refining it. So start writing as outlines, start writing as initial thoughts, name the different versions of your draft or label them as date and have it in a folder, and keep refining your drafts. So as you plan, these are the things that you will need to think about. What do I want this paper to achieve? In which direction do I want my contributions to direct science? What do I want to say? What is the main contribution that I want to actually give? Because there may be many things coming out of your research, but what is the primary contribution that I want to focus? Who do I want to say? Do I want to say to the palliative fraternity, or do I want to say to the primary healthcare people? What is the best way to say it, and where should I say it? So the general layout of an original research, you need to follow the IMRAD structure, that is the introduction, materials and methods, results, discussions and conclusions. The other things to think of would be the title, the abstract, and what you would like to go as supplementary material. So I'm sure all of us would have read storybooks. Maybe some of you have also written stories. So scientific writing, think of it as story writing. You want to tell your research story. So the abstract is like the summary of the story. The title is the story name. Introduction is like the beginning or setting the stage for the story. The methods contribute the middle section, results, the end of the story, and the discussion is like the moral of the story. So think of a manuscript like a research story. Remember that what you write actually goes through the eyes of different people. The first is the editor. The editor is really looking to see if your work is going to contribute significantly to scientific literature. The reviewers, as they look at the manuscript, are seeing for the scientific robustness. Is it done in the right method? What is the content and what is the quality of this manuscript? The readers, as they read your manuscript, are quite international in this day and age. And they can be general clinicians to policymakers to researchers. Is this a topic that interests them? Is your manuscript easily readable? And as a writer, you're looking at it to try and convey all that you want to convey, that you've done it well, you've done it right, your work has credibility, and you want to convey important contributions. So journals are really looking at citable manuscripts, and highly cited manuscripts are those which have a combination of quality, which includes reproducibility, good ethics, and readability with novelty. So 3 things, as I mentioned, define quality manuscript. One is reproducibility. So your methodology should be very, very detailed and clear, so that any other person just reading through your methodology is able to repeat, should be able to repeat the study. Ethics, it should be correctly carried out, and readability, the language should be effective to communicate the concepts adequately. So novelty is, so the 2 aspects, one is quality, other thing is novelty. So is this contribution novel in any way? Am I talking about a new drug, a new intervention? I know during the pandemic, these kind of new interventions, new things just took priority. When you talk about a new disease or a new problem, a problem that has not been spoken about much, then it becomes novel. Or are you looking at the same drug in a different patient population? Then again, for example, it may be like use of mirtazapine in polysymptomatology. So we know mirtazapine is an antidepressant, but what about in a different group of symptoms in palliative care patients? Are you coming out with some definitive data in a controversial area, or extending previous findings, or your study is really novel in the sense it's very multicentric, your sample size, the study population is large. So all these contribute to the novelty of the manuscript. So once you've done your study and you're thinking of writing, where do I now send my manuscript to? So it's good for you to think about the different journals and go through some of the scope. In the journal homepage, you will be able to read about the scope of the journal. So what sort of audience they cater to, what are their preferred. Many of them actually list down the study types they are interested and the different specific topics they may be interested. Look at the back issues of different journal articles. What sort of articles are coming out? What is the impact factor? However, be very realistic when you choose your journal, because the journals with very high impact factors have a very high rejection rate too, like JAMA, NEJM, BMJ, Lancet would have a rejection rate of more than 90%. Go to experienced colleagues and mentors and ask them where your manuscript would best fit in. Think about the audience that you want to speak your message to. Is it a specialty crowd or the general medical people? Don't be over enthusiastic, in the sense you are able to assess the quality and potential impact of your work and accordingly choose journals. You might also be guided by the institution or promotion requirements. If they are, you might want to look for index journals, and also the urgency of publication. And again, journal homepages would give you the time to decision that they would take if you submit to that particular journal. The first thing to do once you've decided a journal is actually go read through the author instructions. Very, very important, because this is one of the main reasons that manuscripts can get rejected if you do not follow instructions for authors provided in journals. Actually, when you're free, this is a good thing to read up also. Recommendations for the conduct, reporting, editing, and publication of scholarly work in medical journals, which has been recently updated. So where do I start? Okay. So I would say methods, and probably you already have this written up as part of your proposal. Before your start of the study, even you have the methods written up. So start there, go through it, write as subsections. Write in past tense. We will see what comes under each of these subsections. And write in a way, read it and see as if, if another person reads through your methodology, whether they will be able to duplicate your study. So what should your methods consist? The design of the study. Describe that elaborately. How did you choose your sample size? Who is your population, study population? What is the inclusion and exclusion criteria? If there are, if you need to define certain terms that you've used when you call somebody as advanced cancer, then what do you mean by advanced cancer? Which particular stage? Define them. What are your interventions and comparators? Again, define them and make it very clear. What outcomes did you look at? What were the measurement tools you used? When were they measured? How were they measured? Who measured? Keep all this very elaborate so that whoever reading this is able to actually picturize how you have conducted the study. And for analysis, use proper statistical analysis. It is always good and recommended to have a statistician included in your as part of your research. And you need to state the IRB approval with the number. And if it is an intervention trial, you will also need to state the clinical trial registration details. There are reporting guidelines for different sorts of studies. Follow them. Keep your methods 2 to 3 pages in a double-spaced. Once your methods are clear, go on to results, followed by the introduction section and the discussion. Stay true to your results. Last couple of sections you would think of would be abstract and conclusion. So in each of these sections, you can just initially start as an outline, put as bullet points, all the things that you think you should include. Slowly get them into sentences and paragraphs, and thus advance your story. Title, abstract, tables and figures, which are often last minute things, actually need maximum attention. We would come to each of these sections. So in the result section, you're actually telling what you found, you found in your study. Keep it around 2 pages. Use past tense because you have completed it and you're telling what has happened. Present facts in a very organized and logical order. Again, like the methods, you talk about the subjects, the sample size, maybe some basic demographics, then about the intervention or the exposure, any comparator. Then go on to the outcomes, definitely the primary outcome and the different secondary outcomes. Keep them in different paragraphs so that it is easier for the reader. And in your result section, often there is no need for any references unless you are referring to a particular tool that was used or some validated method you are referring to. And tables, graphs, and figures can be used to supplement results. you would see that most original research will have tables and figures, and they are a go-to for many of us, and it's an excellent way to communicate complex information. Look at how many tables or figures are allowed. Generally, they are around 5, 2 plus 3 or 3 plus 2. You can play around as to how you want to use them. Project results for the primary and secondary outcomes. Actually, this gives additional clarity. Looking at a table, looking at a graph or a figure gives additional clarity to your results. Don't try and repeat everything that you put in a table in the text. However, the key findings can be included in your results section. Be careful as you enter data into tables and check them again for whether you've entered those numbers carefully, whether the numbers in the tables and in the manuscript actually match, because these are small errors that can happen. If you have some more data that you want to provide as tables and figures, you can give them as supplementary material. Remember that often when you glance through a article, sometimes even we would go if you want to just get the results, if you want to get what it says, one of the first thing you might see is the title, the abstract, but what you would use in your presentations or what you'd look are the tables. So look at it at that way, that tables and figures should be able to talk on their own. Don't just write patient demographics. Give a proper title, say details of palliative care outpatients with pain. So that the table in itself can stand on its own, both in the title, provide footnotes when needed, use abbreviations, you use the expanded form, give that below the table, and label and number your tables and figures. So introduction is the next section you would think of writing, and you can divide your introduction mentally as 3 different sections. In the first part, you talk about the broad problem. If you're talking about pain, okay, the broad problem of pain in cancer patients, what is already known. Then you come to your specific purpose of focus of, you want to look at neuropathic pain, and what is, maybe in the broad problem, you'd also say what is already known about neuropathic pain and what interventions are available. Now coming to the specific focus, why there is a gap, what is the gap that you have found in addressing neuropathic pain? Focus on that, and then state what is the rationale of the research that you've conducted, what questions you are going to focus on, and just enlist the primary objective or maybe the key secondary objective. Be very careful to keep this background or the introduction section quite short and focused. Don't exceed 2 double-spaced pages, and keep the literature review relevant, balanced, and recent, current literature rather than old ones. Going on to discussion, so you've done the methods, the research, the methods, the introduction, methods, results, introduction, and then discussion, I told you, is like the moral of the story. So now the reader needs to get this whole thing in context. So you're going to write this as one of the last sections. You start off with a concise summary of important findings, 3 or 5 findings. Don't repeat the entire results section, but just give a concise summary. Then go on to talk how your work or how your results align with previous findings or are different, or what is new. If there are confounding factors or things that you need to look at differently, point that out to your readers. Why you've got a certain result in a different way. What do you think are the possible reasons? Highlight any strengths and limitations. Definitely you will highlight, if it is a large study, you would say it's the first one with this many, more than 1,000 patients, or any new intervention that you have done. But definitely talk about limitations. It is better that you talk about limitations of your study rather than the reviewer writing down limitations. And how these would apply, how these limitations actually affect interpretation and application of findings. Certainly, one last section should be on how your findings have helped to advance the field, or how you are not yet there and this needs further researching. How certain things can be considered in clinical practice and how that can be changed, and things that demand further attention. Even within the, sometimes some journals might have a separate conclusion section, but otherwise in the discussion itself, your last paragraph should be to conclude, to provide some concise and clear takeaway messages. Highlight specific areas for improvement with future studies. One mistake that many people can make is overgeneralization of the implications of their study. As researchers, as someone who's worked hard with the study, and what you found, that you are obviously very enthusiastic and you want to say that, you know, it is so good and this is applicable everywhere. And but be very careful when you overgeneralize your findings, because this is something that can put off reviewers if you're talking more than what the study actually has found out. And avoid repetition of concepts. Common errors that we can do in the discussion section are, sometimes we can completely repeat a lot of the data from results in the discussion section. That is why I said the first paragraph should be just a concise summary of key findings. Don't include information unrelated to the purpose of this article. You know, sometimes you've gathered so many articles, so much of literature review, you put in some in the introduction and you somehow want to put them into discussion. Don't do that. If it is not related to what your findings are, not relevant, do not include them. Don't repeat when you see how your articles are, how your finding is going along with other findings. Don't verbatim repeat findings from other studies, but definitely highlight them, but critically interpret and analyze and highlight them so it makes sense for the readers. Don't bring in new data, new details which you've not described in your methods or your results section. And again, have the scientific humility and do not overstate interpretation of results. Keep the discussion to not more than 4 double-spaced pages and do this in the present tense. So coming to your abstract, this is the last section that you write. Abstract is the summary of your study. And generally, this is the last section written, but it is a very important section, because we know as readers, we don't sit and read every article. If the title entices us, then we go on to the abstract. And this may be the only section that many people read, sometimes out of interest, and sometimes if they don't have access, they end up just reading only the abstract. And so this should be a standalone from the manuscript and must convey the entire message which is present in your manuscript very effectively and concisely. Follow journal requirements for the structure and the word count. Do not use references, abbreviations, and acronyms within the abstract. Sometimes we do use abbreviations or acronyms, but be wise in doing that. Facts which are already known are given in the present tense, while your findings still you present in the past tense. So different journals would have different structure for abstract. So again, please, we should read author's instructions, because again, these are things that really talk about yourself to the reviewer if you have not followed the structure that they have provided. So the background should again be just a brief statement of maybe a line, one-liner on the current knowledge of the issue and a one-line on the gap that you identify and why that matters. Methodology, definitely what method was or approach was used, and one line on what are the primary or secondary outcomes. The key findings from the study, only the key findings should be listed in the results. Focus on only the primary outcome and one or two secondary outcomes. Conclusion should directly come from your results. Do not make your general assumptions and bring them into the conclusion. Do not overestimate the relevance of the results that you have obtained. You can highlight the broader significance and future direction that will help advance this sort of research. Title is actually the shortest abstract. So often the title is what takes us to the abstract and then to the entire full text if we want to. So this attracts readers. So somebody might just read the title and that is the last thing they read. So think early, take time and effort. You can keep writing a list of titles that keep coming to your mind. And sometimes you can merge them, you can hone them down. Identify keywords that you would like to go into the title that should reflect what concept is coming across in your paper. Title is not just for the reader, it's often sometimes a reminder to us, the writer, to keep focus on the main message. You know, what I am writing, is it in alignment with my title? Avoid jargons or non-standard abbreviations or words with little or no meaning in the title. State the issue that has been addressed rather than the conclusions of your study. Shorter titles apparently seem to have higher citation, so they say around 12 words is a good length for a title. Specific countries in the title, name of specific countries in the title carry poor citation. Going on to references, so this is another area where reviewers can get put off, in the sense you have to cite facts, quotes, or other results. So when you preview your manuscript before submission, as you read, you ask yourself whether this needs to be cited. Ask yourself whether you've taken this from somewhere. And this, so as you do that, this also helps and directs readers to additional information. See that your citations or your references are quite recent. And whenever you cite a certain, maybe a tool, try and go to the original research where possible, rather than citing a study that used that tool. Read what you cite. So if you provided references, definitely go to that article and read that section before you have cited, so that you've done it in context. How you reference, there are different styles and requirements by the journals, so stick to that. Go through some of their recent publications and see whether there's sometimes a subtle difference between what the journal requirements are and the recent articles. So you can see both to help you guide your how you need to reference. Stick to the maximum number of references. Avoid citing abstracts, personal communications. If it is really, really essential, sometimes in systematic reviews, you include cite the name of the person, date of communication in parentheses within the text. There are many electronic reference management softwares, and you could use one that you're familiar with. When you submit your manuscript, they will always ask for keywords. And what is the role of these keywords? These keywords are going to help readers identify your work, and they enable database searching of the article. So this also should be provided in compliance with journal specifications. Some journals specifically recommend from the US National Library of Medicine's collection of medical subject headings, the MESH. mesh terms. So include specific terms which specify the topic or your method or any new innovation that has come out from your study. Avoid overlapping keywords in your title and keyword list, because even title words will come up during a search. So try and keep them different. Going on to authorship. So the ICMJE, this is the International Committee of Medical Journal Editors, recommend that authorship should be based on 4 following criteria. Substantial contributions to the concept, design of the work, or acquisition, analysis, and interpretation of data, and drafting the work or revising it critically for important intellectual content, and final approval of the version to be published, and agreeing to be accountable to all aspects of the work in ensuring that questions related to the accuracy, integrity are appropriately investigated and resolved. So all these 4 criteria need to be fulfilled if a person needs to be an author. So acknowledgement is those who have there will be a section on acknowledgement. So those whose contributions have not qualified for authorship should be listed under acknowledgement. For example, someone's help in acquisition of funding or general supervision, administrative work, support, editing, proofreading. You can list the name of these people in the acknowledgement section. Clarify upfront the author of authorship, expectations, and responsibilities of each co-author, so that the work or the manuscript writing is done in a coherent way, but each person knows what they are expected to do. Unethical authorship are of different kinds. Coercion authorship, when a person in position or authority asks or expects to be listed as an author without contributing. Mutual support, admiration authorship is adding colleagues or friends who did not contribute. So you add my name, I add your name. Gift authorship, mentors, key opinion leaders who did not contribute, having their names. And these all classify under unethical authorship. We spoke about reporting guidelines earlier, and the Equator Network, if you go, will provide a consistent, many different guidelines for different sort of studies. And the importance of this is these guidelines provide a consistent framework for reporting. It does not mean that if you report according to these guidelines, your manuscript will be accepted. But if it is a good study and you have followed these guidelines, it enhances the chances of acceptance. So there are many, there are different sort of studies and different guidelines to guide reporting. Now, once you are done, it is very, very important that you do not, often there is a very sense of relief when you kind of finish different sections and you're done. But just don't immediately submit to the journal. Maybe keep it away for 1 or 2 days. Come out of all that you've done and take a fresh look at it after maybe a couple of days or even a week. And as you read, now go look at different other aspects. Look at the language, look at the construct and logical flow. Focus, see if your focus is on the core message or you're getting distracted in different places. And then this is a time when you will have to ruthlessly edit or remove certain things. Again, the entire article, there will be a word count. See if you are complying to that. So see if your language is simple, clear. You have defined all technical terms, because if you remember, one of the aspects of a quality manuscript is its readability. So for a person who is not done the study, who's not that familiar with what this area of expertise, does it make sense? Avoid abbreviations, acronyms, and jargons. Look for grammatical and typographical errors. Again, this is something that can put off editors or reviewers if the English is quite difficult to read. Pay attention to font style at different levels. The main, the title, the main headings, subheadings, use different font styles so the flow is very clear to the reader. It is a good idea to give your manuscript, once you have done this pre-submission reading, you and the co-authors, you can give it to someone who has not been involved in this research at all, to someone, maybe a good mentor or a friend, and ask them to read it with new eyes and take their suggestions. The core message should be obvious throughout, starting from the title, abstract, and the other sections. Don't tell more than necessary. This is a big temptation to say all that you know or all that you want to say, but keep asking whether this is necessary. Is it pointing in the, is it necessary for the core message which I am conveying, or is it a distractor? Because if you start focusing on multiple aspects or try telling multiple takeaways, then you stand a risk of becoming less convincing. So edit ruthlessly. You will know that all manuscript submissions go with a covering letter, and that should be very convincing, because sometimes the editor might just see only that. And if you are able to sell your manuscript well in a cover letter, then it might move from the editor for peer review. So you submit, and then sometimes you need to wait for weeks or months, because again, getting reviewers is also not an easy job. And very, very rare that a manuscript at first shot comes back as accepted. It is extremely rare, but if it so happens, well done, go ahead and celebrate. But the common thing you might get back is, or not common, one of the responses would be revised with major or minor revision as a major revision or a minor revision. And here you need to, this is your second chance. So I think this needs to be taken very, very seriously. So read through very clearly what each reviewer has written. Most peer-reviewed articles get reviewed at least by 2 reviewers. So see what each reviewer has pointed out. Sometimes there may be a slight contradiction with what each of them want, and you have to be very wise in the way you respond. Share the reviewer's suggestions with the co-authors. Again, don't be very quick in answering. Take time, get help, provide thoughtful, recent replies, point by point. You know, often this goes back to the reviewer. So they need to feel, you have clarified, you've taken their point seriously, and you have clarified it to them in a very easy way that they can see and understand, and it makes sense. This doesn't mean that you agree with everything that the reviewer is saying. If you think that they have misunderstood or they have not got you correctly, you can clarify, but do that very gently and very humbly in a respectful way. And if it is a reject, they have not rejected you, they've just rejected your paper. It is part of the publishing game, and so do not stop there. Because most journals accept less than 20% of the manuscripts they receive. So somewhere yours will get rejected. So do not take it to heart. And even if it is multiple rejects, if you're convinced, you know what, and with each reject, they also give their observations. So again, you can keep improvising unless there are technical reasons where you need to kind of do something further on your study. We'll come to that. So manuscripts can get rejected for technical reasons or editorial reasons. Once you're able to correct that, please move on to submit to another journal, taking the reviewer's suggestions if you agree with them. So technical reasons often will require you to do some more work on your study. It's like going back and probably reanalyzing or extracting some more data and then submitting. So it may be that the data is incomplete, the sample size is too small, the analysis, you've not used the right statistical tests, the methodology is incorrect, or the research motive or the hypothesis itself is not clearly explained or not valid, and what you asked and what you answered, there is a mismatch, or the conclusions, a lot of assumptions are not really supported by data. So these can be the different technical reasons why a manuscript can get rejected. There are often it is editorial reasons, and most of the time, if you see, it will be because it is out of the scope of that journal, or it's not, does not have enough impact for that particular journal. Research ethics is ignored. You have not followed proper structure or the formatting requirements of that particular journal. So some of these actually are very, like in our palliative care terminology, these are all correctable and doable and reversible things. You're not providing the necessary detail for readers to fully understand, and they feel that, you know, this is not, the quality is not good because it cannot be reproduced. Lack of up-to-date references, poor language quality, and difficult to follow logic or poorly presented data. So I've just, interestingly, there are many articles many studies looking at reasons for manuscript rejection, and this is one where they looked at reasons for rejection from American Journal of Ronchinology. And actually, they looked at 18 countries. I have not put all of them. I've just put the first 3 and India's. So the commonest reason for rejection, as you see, is lack of new or useful knowledge. So what one of the key things that they are really looking at is novelty. Is this adding something new? Or is it, are you studying the same thing in a new group of patients? So it is important for you to keep in mind, even when you plan research, whether there is some element of novelty in what you're planning and doing. Methodological errors, errors in data analysis, poor language, referees, meaning there are no other reasons except that the reviewer has not accepted and not suitable for that particular journal. So coming to some useful tips. So don't, I hope this this session is really moves you on to do something to get started with your dissertation or thesis. Get started. Don't wait for large chunks of time. Even if it is in a routine clinical day, if there's an half an hour, just 15 minutes, start with just writing an outline. All that you may write is introduction, methods, results, discussion, but at least put those headings. And then you start putting down bullet points of what you want in each of these sections. And today I've given you an overview. So in the introduction, you want to think of 3 sections: the broad context, the specific focus, and what you want to address. In the methods, the design, the population intervention comparison outcome, how you're measuring it, ethics. So just put these as an list it down, each of these. And then slowly you can evolve them into paragraphs and then the larger story. I have given you a flow, how to start and go, but please start where you feel is easiest. You know, some of us, we want to start with the literature review, that's fine. So start where you feel comfortable. Allot dedicated time to write. So actually this itself will be a positive booster. Something you have written actually will help you to go on to it the next day. The longer you wait, you might not start. Keep the structure of the manuscript in mind. Get help of co-authors to overcome specific barriers. Some of us might be good at statistics. Some of us that might not be our strength. So it doesn't matter. And that is why it is often teamwork. It's good to have a statistician. It's good to have people who are strong in different areas. So you can get help from others in those areas where you feel you might not be the best person. Be patient, persevere, and try and make it enjoyable. So my take-home messages are that writing is a skill. It's a discipline. It can be learned. I'm sure seniors here who have started will be able to say the long way that they have come, which definitely is a learning process. Start early in your career. Don't postpone, and especially MD students, don't once you finished your MD, be at it to complete your thesis, convert your thesis into a publication. So start early. Take time, plan. Most important, read journal instructions, write clearly, accurately, and succinctly. Don't think you have to use big words, exotic statements. I think what they are looking at is it clear? Is it readable? And is there a flow? Is there a logic? Is there too much of assumption? So don't overstate what you found. Take time to polish your work before submission, because when you write, there are so much of thoughts and so much of information you put together. But I think the pre-submission time of reading it through, both all the yourself as a team and asking for someone, an internal reviewer to go through it, is a very, very crucial step. Face up and respond to reviewers' response. Never give up. It is hard work and challenging, but satisfying and rewarding. There are many publications on writing a good manuscript, but this Equator Network website also gives you many resources on writing. Thank you very much.
Thank you, Dr. Jenifer. It was so wonderful. I think there are so many questions. And would you like to read questions and answer, or should I read?
No, ma'am.
Dr. Jenifer, I have to attend another meeting in 2-3 minutes. So
sure.
Can you continue and finish this and summarize everything?
Yes, ma'am. Yes, ma'am. Yeah, will do. Thank you.
For another 2 minutes, and then I have to leave for another meeting. Okay.
Sure. Thank you, ma'am. Thank you. I'll
read
the questions.
Presentation, and I hope that all the MDs will get motivated and they will start writing good publication from their thesis. There are so many MDs, those who have not even finished they finished the senior residency, 3 years of senior residency, they have joined job, but they have not written the manuscript from their thesis. So I think it's a very, very important lecture, and you have given excellent presentation today, Dr. Jenifer. Thanks a lot. So kindly read the questions, because there are so many questions I can see.
Okay.
Okay.
Yes, ma'am. I'll go through them.
Okay. Thank you. And don't forget the audience to join next Monday before 6:30. We will learn referencing next week. Thank you, Dr. Jenifer. Go ahead with the question.
Yeah, so the first question is, kindly clarify whether the discussion section contains only comparisons with related studies or it needs explanation as well. Yes. So the question is whether the discussion section contains only comparisons with related studies or it needs explanation as well why results vary. So it's an important question. So your discussion, first you're summarizing your results. Then definitely see if there are similar studies which also show similar results or which show different results. Think through as to why. That is why it's important to read the studies that you're quoting, so that you understand the context. Maybe the patient population is less, or maybe the time they studied their outcome was different from yours. So make relevant observations and explain it to the readers, because the readers are not going to go and read the other studies that you're quoting. So not just comparison, even in your study, if you've got results which are not going to your logical, not along logical thinking, there's something different that has come out. If you can find an explanation, you explain, but if you can't, you can sometimes just leave it that we were surprised to see this. we are not really able to explain why these results stood out the way they stood, very different from what many other studies have found. So you explain results, variations within your own study, but also make necessary comparisons with other studies, but critically say why it is same or different. Kindly put light on your suggestions on previously conducted studies. Tarun has said, kindly put light on your suggestions on previously conducted studies in last 4 years and now have publications on this. Tarun, can you unmute and speak? Tarun, are you there?
Yeah, yes. Thank you, Doctor. Because it was unmute. It was mute. Oh, thank you for the wonderful lecture. I really appreciate it. Which is only my question, like say for 3 to 4 years before we have conducted some studies, and recently we found, like this month only I found that one study has been published on that. But say for about sleeping positions in some stages of diseases, and we found some sensor has been used in another part of the world. Like say for if it has been explored already by publication, but our methodology was different to find the quality of sleep or something. Can we publish it? Because the authors may feel that, okay, this has already been explored. So,
definitely, yeah. No, definitely you should publish. In the sense, see, no two studies in two different places are going to be identical unless you planned it together. So there is always something that is going to be different, either meaning even generalizability, if it is done in a different country or in the developed countries and ours, that itself is sufficient to say that the population is different. And I'm sure your methodology or something will be different. So definitely don't get hindered just because something has been published while you were actually doing the study. So it's important when you start a study to see what is already known. I think that is important. But when you're not exactly replicating, but something has come up while you've been doing the study, but some things are different, please go ahead and publish. There will be differences for people to learn on. I hope that answers your question. Dr. Stanley has asked, please give guidance on writing an editorial. Sir, actually, letter to the editor is something that we can write, meaning we found an article, a research article, and you want to emphasize something or you want to highlight something that they have missed, which is important or which you have observed or previous studies have shown, we can write as a letter to an editor. But editorial and commentaries are usually at the request of an editor. So the editor might request for people who are well versed in a particular area to say, can you write an editorial on that?
Thank you.
Can we change or shorten the title for publication only, which is not the same as in the ethics approval letter? Yes, I think you don't have to stick by the title, but you will need to stick with the methodology and what you've described. So the question here is, can we shorten the title for publication only, which is not the same as we get in the ethics approval letter? That is fine. You should stick to your methodology, your inclusion-exclusion criteria. You should not go wrong. You should not change your methodology. That is more important. Title, yes, certainly, that should not be a problem. Which is better to cite research article or book chapter having the research article? Definitely the research article. So always go to the original research article. And even in the research article, like I mentioned during my presentation, don't quote. So supposing somebody is quoting SPICT tool. The SPICT tool has been used in different studies, but you go to that original publication where SPICT tool was validated and introduced. That is the article that is best to cite. Citing very old case report reviews or recent review having that case report. as one reference, which needs to be cited, which is better. So if you're talking about that particular case report, that patient, you have to cite the case report. If you're saying there has been a report where they used metrazapine for something, for chronic cough, and that helped, so then you cite the case report. But if you're talking about a review article, if you're saying a recent review reveals that metrazapine has been helpful in cough, in nausea, vomiting, appetite, whatever, then you quote the review article. So stick close to what you're writing and state that. How do, last question by Tarun, thank you. But how to reference old studies? Can we cite the old reference which we have used for proposal and writing discussion, or we need to include the recently published? So in your proposal, you may have used, when you're submitting your research proposal or for approval, you may have used certain references that were available then, or you didn't do a complete review and you have submitted, that's fine. But you don't have to stick to that. When you're writing, you look for recent publications and you use that. So thank you very much for attending and for this interactive time. We've just crossed 7:30, so, and there are no more questions. So thank you, Archana and Nisha. Have a good day.